Hi, this is Dr. Ryan Edwards again with Windermere Dental in Cumming, Georgia. Thanks again for coming here to check out this video. This one, I don't really have any tips to share with you. This is an office update on the status of our office. I've had several questions from people asking what's going on. We are continuing to follow the American Dental Association guidelines. Our office is going to be closed at least until April 30th, except for emergencies, but we're closed for elective dental procedures. So I am still seeing emergency patients. If you have throbbing pain, swelling, anything that you might think needs to be something that would otherwise send you to the emergency room, I'm here to help you out and check you and take care of you and do what needs to be done to help you avoid going to the emergency room. They don't want you there because they're busy with other patients. You don't want to be there because you don't want to run the risk of getting COVID-19. So that would be a time to call me. Like I said, throbbing pain, swelling, trauma, things like that, let me know. If you have other questions or concerns, you can also let me know about that. You are welcome to call me on my cell phone anytime you need to. My cell phone's available on the emergency answering machine at the office. If you'd like to make an online appointment with me, I'm also available for that. You can see me, we can do FaceTime or Skype, whatever works best for you. Just call the office to set that up and schedule it. We'll work that out. And I'm also posting videos such as this one and others I've posted on Facebook and on YouTube to help give you tips on how to stay healthy and good home remedies. So you can check out all those sources out for more help. Okay, so why are we still closed? Well, we are following the ADA's recommendations to stay closed until April 30th at the very least. We're also, trying to practice social distancing, and doing dental work on somebody is about as opposite from social distancing as you can get. We are right in your face. And on top of that, we are using air and water to produce what's called an aerosol. An aerosol is like a really fine mist, which it can actually contain the virus, and that is basically how they're thinking that the virus is spreading, is in such things as aerosols, even from speaking or breathing on somebody. So for us, producing aerosols while we're working on you has the potential for transmitting the virus. So we have to take some precautions and do what we can to make sure our risk is as low as possible. On top of that, the patients who are at highest risk for having significant medical problems include patients who have a history of respiratory problems, heart problems, liver and kidney issues, patients who are immunocompromised, patients with severe obesity, and even patients with diabetes. We see patients in all of those categories. So if you came in, maybe you didn't have symptoms and you transmitted it to us or even somebody else who was there in the office at the same time, and then we began to spread it to other people, that would potentially hasten a second wave of infections, and we don't want to be part of the cause of that. So that's another reason that we're being as careful as we possibly can and making the right decision as far as when to come back and what precautions to use. All right, so naturally the next question everyone's been asking is, when exactly will we be open again? When can we start to schedule people? Right now, we're still waiting for clearance from federal and state authorities, the American Dental Association, the CDC, and even our Georgia State Dental Board. And so that you're aware, the State Dental Board is responsible for enforcing the laws related to the practice of dentistry in the state. I have actually had reports coming from other people I know in the dental community that there are dentists around the country who are being investigated by their dental boards for doing non-emergency procedures on patients, and they're being investigated by the dental board for putting the community and for putting people at risk. And essentially those dentists are now at risk for a disciplinary measure by their state boards. So the states and the governments around the country are taking this very seriously, and they're making it known to us dentists that we really should be exercising all the precautions that we should. So you can understand from my point of view why the office is closed as well. I would also make a comment personally. I would question the decision making of any dentist who would be putting their patients and their community at risk in doing so. I would suggest that if you have a dentist that contacts you to schedule something like a cleaning or a filling, you may want to have a conversation with them and investigate. If your area is a high-risk area where the infection is spreading, you probably should reschedule your appointment. All right, so rest assured, when we reopen, we will need to make a number of changes in the office. First and foremost, we'll need to be changing how we schedule patients. We'll need to change how we move patients into the office, and then how we move them through the office and then check you out. We'll need to make some changes to how we protect our staff. So we'll make sure that you're aware of all of those Once we have our plan set in motion, we'll contact that to you. We'll give you that information and contact you. And rest assured also, if you are an emergency patient who has contacted me for any reason, if you have an outstanding issue that we need to address, we've got a list of all those folks. We will get to you as quickly as we possibly can in a safe manner for everybody. So we haven't forgotten about you, rest assured. Thanks again for checking out this video. I appreciate it. Going forward, make sure you continue to wash your hands well. Make sure also that you practice social distancing the way you're supposed to. And I would encourage you, please, I want my patients to have a really high standard for what they believe and what kind of information that they believe. So if you see something on Facebook, or if a friend emails you about something, follow up and check on the source of the information. Make sure it's a legitimate source. I've heard stories about some people claiming that things like toothpaste will cure COVID-19. That's not the case. Even like hot tea doesn't work. So check your sources, make sure you're getting your information from a legitimate source. That's it. Check out, hit that like button, I would appreciate it. You can actually check out my other videos on this channel. I'll throw up a link to the most recent one, which was how to floss. And you can always subscribe and check out our videos. We're on a pretty good rate of getting these out on every Monday. So we'll see you again next time. Thanks.